Hi, Jamie Davis here from the Nursing Show at the ANIA conference in Philadelphia, talking about nursing informatics. And I've got Grace Jaime here from OneView Healthcare. And Grace, you're a nurse, you're a business executive, and you really bring a lot to the table. So we're going to talk a little bit about OneView Healthcare. But before we get started on that, can you tell the audience a little bit about your journey as a nurse? Why did you want to become a nurse, and what that journey looked like?
Sure. Thank you very much, Jamie. Okay. So I began my journey as a nurse in the ED, emergency department in New York City, one of the busiest trauma centers in New York City. And while I was doing that, I was thinking, what else? What was I going to do for a graduate education? And then I became very interested in the business of healthcare and the economics of healthcare, and really how healthcare organizations can achieve strategic positioning in the market. And so I pursued my MBA in business and continued to work in healthcare as a nurse, then as a hospital administrator. Then I went to work at Big Five Consulting, and then from there continued into top EHR companies. And now I'm with a patient engagement company called OneView, and it really is an up-and-coming space. And it's really exciting, and it's very serendipitous in terms of engaging patients and nurses and helping the communication strategies between them.
Yeah, I'm hearing so many exciting developments in nursing informatics and patient engagement and how we use technology to communicate with patients. So tell us a little bit about OneView Healthcare and just a little bit about the company and what you guys are doing.
Sure, thank you. So the special thing about OneView Healthcare is that OneView Healthcare provides a voice for the client. So one of the things that I learned, and many nurses learn, is that an engaged patient really leads to positive healthcare outcomes, because that patient understands their condition, their disease, and really how to get to wellness. And what OneView does is it allows the patient and the provider to communicate effectively and give a voice to the patient so that they can be an active participant in their wellness plan.
Why is it so important to first have technology be an active part of the patient engagement process? Because nurses have been engaging patients through education and other ways throughout the history of nursing. Mm-hmm. But now that we have technology becoming such an integral part of that, why is it that technology is important to be there, and how do we make sure the technology doesn't become the primary thing and the driver, and we take away from the nurse's involvement?
Right. So at OneView Healthcare, we were very, very purposeful in assuring that the technology was optimizing and really empowering the natural workflows of both the clinicians and the patients. And so from a patient perspective, we want to give the patient a reason to use it. And so what we've done is, as our company name implies, OneView, we provide all of the patient engagement components within our platform. So that also includes education, entertainment, gaming, social media, Skyping, ordering meals, being able to communicate with their providers. And for the nurse and or the provider, it gives them an opportunity within their workflow to appropriately understand how engaged the patient is. And one thing that's a beautiful feature is that it eliminates what we used to have as like pieces of paper, because these are things that usually do not live within your traditional EHR or your ADT or any other system. It really is on top of it. So that's the beauty of it.
That's excellent. Where can people find out? Is there a website if somebody wants to look up OneView Healthcare? Where would they find that?
Absolutely. So oneviewhealthcare.com. We are an Irish company. We're very proud of that. And there's a demo, short one, that anyone that looks at the website can get an idea of what we do. We like to say that we keep it simple, but very, very, very effective. So,
Well, Grace, thanks so much for joining me here on the show here in ANIA, and have safe travels back home when you get done here.
thank you. Thank you very much, Jamie.
And I want to thank all of you for checking out this segment here for the Nursing Show at ANIA 2015 in Philadelphia, talking about nursing informatics. Remember to check out more segments from this conference on this channel you're watching or over at NursingShow.com.